So in this video, we're talking about Addison's disease and Cushing's syndrome. And we're putting them together because they're really two sides of the same coin. And so when we say the same coin, we're talking about the levels of a certain body compound, the glucocorticoid levels. So in Addison disease, there are too few, and in hypercortisolism, there's actually too much of it. So in Addison disease, it's primary adrenal insufficiency. So when we're talking about insufficiency, we're talking about an insufficiency of the two steroids that the adrenal glands produce, and those are aldosterone and cortisol. So to help you understand that a little bit better, I'm going to cut over to a video that will help make it more clear, and then we'll come back to our presentation, and then we'll discuss how it manifests itself in the mouth.
The symptoms of Addison's disease are due to a lack of cortisol and aldosterone. You may have heard of cortisol as the stress hormone because it is produced and released in times of stress, for example, a wild bear encounter. Specifically, cortisol causes the breakdown of fats, carbohydrates, and proteins to supply the body with energy, often by converting some of the breakdown products into a high-energy sugar called glucose, a process known as gluconeogenesis, which increases blood sugar levels. In doing so, the body produces energy to use to fight or run away. The release of cortisol involves three organs in your body: the hypothalamus and the anterior pituitary, both of which are found within the brain, and the adrenal glands above the kidneys. These three areas constantly communicate with each other through chemical messengers or hormones. During times of stress, the hypothalamus releases corticotropin-releasing hormone, which tells the anterior pituitary to release adrenocorticotropic hormone, which then tells the adrenal glands to release cortisol. When the hypothalamus and the anterior pituitary detect cortisol, they then stop releasing their respective hormones so that the body does not produce too much cortisol. Aldosterone is also released from the adrenal gland and is involved in increasing blood pressure. It does this by increasing the amount of sodium-potassium pumps in the membrane of renal cells that lie between blood vessels and the tubes where urine passes through. Since both of these corticosteroids are produced by the adrenal glands, damage to the adrenal glands will lead to less production of these corticosteroids, causing Addison's disease. In the developed world, this damage is most commonly due to autoimmune disease, while in less developed areas, tuberculosis infections are the main culprit. A less common cause is cancer cells from other areas in the body that have spread to the adrenal glands and have multiplied, which damages the surrounding cells. In rare situations, genetic mutations may interfere with the proper development of the adrenal glands or cause enzymes that produce these corticosteroids to become dysfunctional. Addison's disease affects around 1 in 100,000 people and is not influenced by sex or gender. It is, however, more common in middle-aged people. To summarize, cortisol is primarily involved in energy generation, while aldosterone is primarily involved in increasing blood pressure. Damage to adrenal glands causes the symptoms for Addison's disease. With less cortisol, the body is less capable of generating energy, so it makes sense that the patient would feel tired and weak. Decreased appetite often accompanies tiredness, which leads to weight loss. Blood sugar is low from decreased gluconeogenesis. With less aldosterone, less water reabsorption occurs, causing low blood pressure. Lightheadedness from suddenly standing up is often a direct consequence of low blood pressure, since the blood flows out of the brain due to gravity more easily. A craving for salt may also be present since less sodium reabsorption occurs. Finally, the most interesting symptom is darkening of the skin, called hyperpigmentation, particularly in old scars, creases in the hands, and the inside of the mouth.
So as you saw in the video, the main cause of Addison disease in the United States is autoimmune diseases. And in the developing world, tuberculosis plays a major part. Also, there are deep fungal infections, HIV infections, and then, as you've heard in so many things we've discussed in this class, sometimes we just don't know the reason. Now, if you'd like to see the full video, I'm also going to include the link in your course of study, where you can find it in your module. Now, when it comes to the clinical features of Addison disease, he mentioned people feeling very tired, very fatigued. And the fact of the matter is it doesn't pop up all of a sudden. In fact, it has a pretty slow onset that doesn't appear until about 90% of the gland has been destroyed. So there's also going to be some GI disturbances as well due to the low aldosterone levels. And all of this is going to worsen without treatment. So something else to be aware of is that deficiency in cortisol in the human body leads to adrenal insufficiency, and that in turn can compromise the individual's ability to adapt to a stressful situation. And some dental appointments for their body can be a very stressful situation. So we should be aware too that cortisol insufficiency can go ahead and manifest itself as a loss of consciousness. It could be a decrease in peripheral vascular resistance, so they lose their blood pressure. They can go into shock or death. We should be very aware that anything could happen. But what's very interesting for us is that the first signs of the disease can show up in the mouth. And that has to do with that darkening of the skin that he mentioned. So that can show up as melanotic macules. And so we learned about macules, of course, and that'll show up on the mucosa. So it starts in the pituitary gland. The gland continues to increase production of ACTH, trying to stimulate the adrenal glands. That hormone, though, also has the effect of stimulating the melanin-producing cells. And so the pigmentation that occurs is pretty diffuse. So throughout the body, it's like the person has started to get this interesting tan. But in the mouth, we're going to end up with those little macules, those little spots of it. And so that actually is going to be where we see it first. It's going to precede the bronzing of the skin. And so as you have this patient who maybe speaks about being very tired and so forth, we can look in their mouth, and if we see unusual pigmentation, then we might want to go ahead and point that out. So this is another place where you can integrate the oral health with their general health and be a first line of defense. And so how is that treated? Well, we'll go ahead and replace the missing steroids. And so it's interesting. We'll take a look at that. Here we have on the left a hyperpigmentation of this patient's gingiva. And then on the right, look at that teenager. So he's standing there with his mother and father, and look at the degree of difference in his pigmentation versus theirs. So now we go into hypercortisolism or Cushing's syndrome. And this one's caused by a continuous increase in the cortisol level, so the hypercortisol. So one of the most common reasons for this is that people go on corticoid steroids for a long period of time. We use it to treat a number of autoimmune diseases and also for organ transplants. Now, another cause is because of pituitary adenoma. So this tumor can cause this sustained release of cortisol. And when that happens, that's when we call it Cushing disease. You can end up with this because of adrenal tumors as well. And with hypercortisolism, again, the clinical signs will develop really slowly. One of the most obvious signs is weight gain, and it also causes other issues like hypertension, hyperglycemia, changes in the mood. And when we talk about the weight gain, one of the things in particular can be this disproportionate weight gain known as moon face. And here we have a picture of this actress from Modern Family, Sarah Hyland. Right there, it may not look like she deals with it, but she does have an issue with that. She fights moon face from taking prednisone. And here we are with, this is a normal woman who, this is her without the treatment or before, and this is her after now dealing with hypercortisolism. So the clinical features for this disease involve the decreased ability to respond to stress, even though there's more cortisol than usual. And that's because the body's feedback loop is altered. So similarly for these patients too, stressful dental appointments can also cause an issue. So if you see something, maybe looking at their face or and you're starting to see this swelling, you have a role to play here in that you can also refer them to go see their endocrinologist. Okay, so that's it for all our endocrine disorders, and next we'll go into blood disorders.